The question is, are there healthcare options outside the typical insurance companies, the federal and the state government programs? Tonight, I want to look into the topic of free market healthcare. My first guest is Dr. Josh Umbehr. Dr. Umbehr runs a Wichita, Kansas direct care family practice. Dr. Umbehr, welcome to the show, sir.
Thank you for having me.
Great. When I was describing this to friends and family about what the show was going to be about this week, and try to describe your medical practice to coworkers, and it left most people scratching their heads. So can you try to explain how your medical practice is run, and is it considered concierge medicine or direct care?
Sure. So basically, 5.5 years ago, we started our practice with the idea that insurance isn't necessarily bad, it's just a tool, and we're using that tool incorrectly for healthcare. It's meant to cover expensive things, car wrecks, cancers, heart attacks, your house burning down, not for medicines, labs, doctor's visits. But part of that, the thing that hinged on that was, can we make healthcare affordable so that you don't need insurance for those things? And we believed we could, and we've proven that we could. So our model is based on a membership model, like a gym. For $10 for kids, $50 for most adults, you get unlimited home visits, work visits, office visits, technology visits like email, cell phone, texting, video chat, and then no copays for anything in the office. And copays are designed to get you to use less care, and we want you to use as much care as you need. And then to further add value to the model, we did wholesale medications and labs. And we're fortunate that Kansas is one of 44 states where physicians can dispense medicines wholesale to their patients or directly. And as such, we can get those from the same suppliers that the pharmacy does. And it turns out the markup on that can be as much as 95+%. So it shows a way that we can have the additional fee of the membership, but bring you value in excess of the membership. And we can do the same thing with labs. A blood test that might cost $50 a CBC, we get for $1.69, and that includes our markup. So very affordable. And then imaging or CAT scan, MRI, we get for about 80% less. So a CT for a little under $200, an MRI for a little under $400. When the cash price with or without insurance can be $1,200, $1,500. And we just said, how much can we bring in value? How can we decrease the cost of care? And cash is king. It always has been, always will be. And so when you cut out the middleman, the red tape, the bureaucracy, the additional layers that slow things down, most places are able to provide their service for a lot less. And that was the overriding theme for the model, and it turns out it works really well. Unlimited visits, no copays, free procedures, wholesale meds and labs represent a huge value.
Sure.
And we can take that value back to employers even and work with their health insurance to lower their premiums by 30 to 60% in the first year. It borders on sounds too good to be true.
Absolutely.
If we know medicines are expensive, healthcare is expensive, labs are expensive, then surely insurance has to be too. But just like we don't have car insurance for gasoline and wouldn't even really buy it, the consumer is smart enough to say, I don't want insurance for that. But the momentum of the status quo in healthcare is that we're just used to buying everything with insurance. Well, Lasix, a common blood pressure medicine.
Right.
I get 1,000 pills for $8. Yes, Walmart will sell you 30 pills for $4 and 90 pills for $10, but I'm still 10 times cheaper. And yeah, okay, that's a small savings. But then there's Imitrex for migraines that can be anywhere from $88 to $256 cash price at our local pharmacies. Well, I get wholesale for $5. So my membership plus your medication, you're making money in our model, with or without your insurance. So now you can start to feel comfortable going back to your insurance and saying, okay, I don't need to have coverage for that. I don't need copays because I don't have copays. I have unlimited visits, so I don't need outpatient care. And before long, you can carve out these things, which are actually more expensive pieces of your insurance. Insuring the catastrophic stuff, car wrecks, cancers, heart attacks, is actually cheaper. because it doesn't happen much.
Right.
And so now we can take the appropriate risk balance. Patients can have the health insurance they want or need for the big stuff while being able to use market forces for everything else and bring that cost down. So again, we've been doing that 5 years. We've grown our own clinic from 1 doctor to 5, but we've helped a little over 170 doctors ourselves move into this model in the last 2 years. We've been featured in Time Magazine. Boston Globe did a great article on direct care on Tuesday, and just it kind of keeps getting momentum. People know that they want something better, and what's the old quote? Nothing more powerful than an idea whose time has come. And I think everybody's ready to look for new ideas and how we deliver health care.
So let me get this clear. You said $50 per month. Is it per month, you said?
Per month, per patient.
So a family of 4 would be $120.
Correct.
Possibly, yeah, with 2 kids. Wow, that's really incredible. And kind of your argument here is if I have car insurance, I'm not going to use it to get an oil change. Why would you use health insurance for a well visit, for example?
Exactly.
Yeah.
When the well visit is essentially free. There is no extra fee for coming in. There's no copay or procedure fee or bookkeeping fee. And if the average doctor has 7 employees per physician to operate an insurance-based model, we have half a full-time equivalent for every doctor, 1 full-time nurse for every 2 physicians. So we can pass the savings in red tape and staff and space on to our patients, and ultimately onto their employer and even the insurance company in a unique way. And a lot of people will say, well, this is an additional fee on top of my insurance. How do I afford this and insurance? To which we try to change that conversation. How do you afford insurance without this? Mm-hmm. How do you afford insurance that covers medicines and labs when that's expensive? It's so much easier to afford insurance when you don't have to cover everything, because now we're going to outcompete Walmart on the price of meds, and the customer benefits from that.
So why did you decide to practice medicine this way? I'm sure this is not something you're taught in med school.
Right, because I love my patients.
Yeah.
Growing up, my dad was a trash man for 20 years. He's a lawyer now, so I still tell people he's a trash man because it's less embarrassing. But he owned his own business, and it was a very simple model, very clean, very easy to operate. And then when I was an undergrad, I worked for a plastic surgeon and saw the sausage being made of insurance billing, and it is all over the place. Very confusing, very unpredictable and disorganized and ineffective. And George Bernard Shaw says there's nothing so useless as doing efficiently the work you shouldn't do in the first place.
There you go.
Well, why do I need to file paperwork for your strep throat? It is strep throat. It's a common cold. It's 3 stitches. It's depression. Not to simplify what we do as physicians necessarily, but to not over-design a product either, over-engineer it. I don't need insurance and paperwork and staff and all to get a little bit more reimbursement. Okay, I guess you could make that argument if it worked, but it's not working. It's driving up the cost of care for patients. It's making it harder for doctors. Over 50% of family physicians now, when surveyed, say they're burnt out. Burnt out physicians don't care about their patients the way they should or could. I didn't want to get burnt out. I wanted to enjoy my patients. I wanted to have time to focus on them and not the paperwork. So we said, business, free market is what would fix these things, and we built it in that direction.
That's great. Now, have you ever calculated what type of savings the average individual would be getting using your direct primary care method as compared to others?
It really kind of depends on the individual, how much are they going to use it. But we had a patient recently doing their taxes, and they said we saved him $3,500 last year, even after their family membership. So family of 4, $1,440 a year, on meds, on labs, on copays, we saved him an ER visit once for the wife's stitches. So some people, if you don't use as much, that's fine. I may have Netflix or a gym membership and not use it too often. But at the same time, if I use it a bunch, I get a lot more value out of it. Sure. And so patients who are on expensive meds that we get cheap, we could easily save them $100 a month on top of what they're doing just with one medicine. And the yearly blood work that you should get, a CBC, a CMP, a lipid panel, thyroid, diabetes, prostate, $12 with us. $300 anywhere else you go.
Sure.
So we really, Charles Koch has a great book out last October, Good Profit, and talking about how do you make a good business. You add value to it. Value. And we want all of our patients to, get the subjective value of knowing you can always text your doctor or call them. You're not vulnerable. You always have someone in your corner. But at the same time, those objective savings. Or an employer group, they spent $103,000 on premiums in 2014. And the way their insurance works, 9 months later, they get a refund check, depending on how effectively they use their insurance, and they got a check for $46,000 back. So for a company of 35-plus employees, everybody got a $1,000 raise. That's huge. So not only does the clinic model help our patients, but it's uniquely positioned to help employers add jobs, get people back to work, make insurance affordable. And the insurance company loves it because they're more profitable in that plan, too. Less administrative hassle, red tape problem. So
you would think this was spread like wildfire, just listening to you.
You'd think. And in a lot of ways it has. So when we started, 1% of doctors said they would consider an insurance-free model. Now, 5.5 years later, the National Academy polls it at 34%. Okay. So in a lot of ways, numbers might still be small, but the momentum is growing significantly.
Sure, but as a physician, having an office practice, the overhead is enormous. You got, X amount of paper pushers, and so what kind of savings do you see as a clinic owner?
Well, the average doctor would have 3 or 4 exam rooms each, so that's a lot of rent, that's a lot of space, it's more utilities, etc. But then also 7 full-time staff. So we have 1 exam room per doc because that's all we really need, and then we have 1 staff member per 2 physicians. So we have 1 where the other offices would have 14. Yeah. That savings is huge, and it goes directly to our patients. But even with less staff, we're doing more. We're drawing the labs. We've got the discounts on that. We're casting things. We're suturing our patients, even after hours. If I save you an ER visit, I've saved you $1,500.
Oh, yeah.
Yeah, I've proven that this is a good thing for you. But we're counting their pills. We're dispensing that. We're answering the phone calls. The best thing I can do is save you a visit. Either, we get you the right medicine sooner, where you don't have to leave work and drive across town and pay a copay and gas. And so now you can call, text, email me your concerns. And some people will tell us more about their depression and anxiety by email than by face-to-face. Mm-hmm. So, I think there's a substantial benefit in lots of ways.
Yeah, what you're describing, it sounds like something that's been we saw decades ago in this country. You're kind of describing you're like a Marcus Welby or something.
Marcus Welby, yeah, absolutely, with an iPhone.
Yeah, there you go. So who is your typical patient then?
I tell you, it runs the gamut. A lot of people make the mistake of saying, well, this must be fine for rich, healthy people. I have no need to take care of rich, healthy people. I'm of no value to them, just like a gym membership for someone who doesn't exercise. This really works out best for the poor and the sick, because that's who I can show an actual savings to. You're on a medicine that's expensive, I get it for you cheap. You're going to the doctor a lot, paying a copay and leaving work, and now there's no copays and unlimited visits, etc. We have, I think a lot of our employer groups are your standard blue collar, your gardener centers, we have some steel workers, we have some truck drivers, and of course we have rich people too who like the service and can't get their other doctor to even call them back, let alone email or text or help out.
Right.
So it really does run the gamut, because really everybody needs health care. It's a commodity like milk or gasoline. Most people are going to use it at some point, but also they want a better product than they're getting. So I think that covers a wide base of patients.
That's a really key thing that you just said, too. It's a commodity like milk or gasoline, and I don't think most people think of it that way.
Yep.
Yeah, you have the right. Yeah, so that's interesting that you said that. Let me ask you, how The Affordable Care Act, has that been good?
Oh, I love it.
Has that been good or bad for your practice?
It's been good for the business.
Yeah, I was going to say.
Politics aside, the left and right side of this bird have both broken the healthcare system.
Sure.
And not intentionally, of course, but I think lack of any innovative ideas. And the government rarely innovates in that direction. So we can't even really blame them. When I talk to medical students or residents or doctors, I say we can't even blame insurance companies. It's our fault as physicians. If we really take our oath seriously of do no harm, that has to mean do no financial harm. I know we as a profession tend to shy away from business for a variety of incorrect reasons, but if there's a business model out there that helps our patients afford their medicines at 95% less, we should adopt that. There's no argument against it. If you can help your patients get the labs they need at 95% savings, we should be doing that. But that's the only thing we can do. That's what we fix. Insurance is just a payment system. Government is really just a bureaucratic payment system, and they don't do anything well, right. Let alone reinvent an industry. So it really came down to doctors, but as the government made healthcare more expensive, they kind of broke the machine faster and more than anything else. So that, I think, really made all the key players want to find change. Now employers are saying, look, this has doubled in the last 5 years. It's going to double again in the next 3 years. Mm-hmm. We can't, bring us something better. And insurance is like, well, geez, we're looking. This isn't even working for us. United lost $1 billion on the exchanges. So it's not just a pure profit motive that the current system is broken for everyone else, but great for them. And then, of course, patients and doctors needing and wanting something better. We talk to doctors who are on the verge of leaving medicine all the time, and then find out that this model can work for them, and they can get back to caring for patients, which is their first passion. So if anything, it's accelerated that conversation and flexibility around a solution.
Well, that's some incredible stuff. Now, you operate another service that's called Atlas.md. Mm-hmm. What's that all about?
Well, in the process, we learned we needed software to help us do what we did. Of course, doctors are used to bad software and really kind of against their own EMRs, electronic medical records. But when we're a young business, we had 9 different platforms, software, one for the pharmacy, shipping, billing, texting, emailing, and they didn't talk to each other. So we said, well, we have to have something more efficient. And over the course of 5 years, slowly started building our own electronic system, and then as the movement grew and more doctors say, I need it too, mm-hmm. We released it out. And so that includes our consulting company, which we do all the consulting free for physicians or employers, just because we're so passionate about the movement, and we want to help doctors do this. We want to help them do it right and be successful. So we do all that for free and have a lot of information available to them online. But then our software package that helps them run their clinic, and that we sell as a product.
Yeah. Well, this show is not political in nature, but I do want to get political because politics and the government are heavily involved in healthcare, unfortunately. Mm-hmm. Now, in your opinion, do you see any of the remaining presidential candidates that have a clear free market vision for healthcare?
Not really. I don't think anyone is coming up with an innovative idea. I think it's a hot topic that no one expects them to fix in a way. A lot of rhetoric, a lot of proposals, a lot of let's do things better. We need more affordable care. Good buzzwords, but not true solutions. And although it'd be great if we could get direct care out as a topic, I almost fear that in the sense once one party picks it up as their idea, it'll instantly be, disavowed by the other party. And when we speak to legislators, often to keep it apolitical, we'll say, just generically, the individuals on the left say, we want more health care for more people. Okay, that's a laudable goal. Mm-hmm. But then the people on the right will say, yeah, but we need to be fiscally appropriate. We only have so many dollars, and we need to spend them well. So business is great at finding a third alternative. I want a faster, better, thinner phone with a longer battery life. Those things don't go together, thinner and longer battery life. But business finds a way. And in our model, we say, look, the state's paying $50 for a blood test we get for $1.69. You can now order a little over 25 times more tests for a budget-friendly or neutral cost. Now we can satisfy both sides. And with less regulation, less expensive insurance, more employment means more taxes, and more employment means fewer people needing Medicaid. So I think there can be a solution there that we want to make sure that neither party just dismisses or accepts for a talking point. But I think if they were to embrace that, they could do a lot of good to show, okay, yeah, let's have a logical answer to these problems instead of just rhetoric.
Okay. I got about 2.5 minutes left with you, Josh. Let me ask you, a couple of the candidates are pretty clearly for a more of a single-payer type of program. And I have personally, I have a sister that lives in Canada, and she boasts about the healthcare system there. Mm-hmm. And what would single-payer healthcare, something I believe that's going to happen in this country in the future, do to healthcare in the United States?
Just divide it. I don't think it'll happen because even the Affordable Care Act is kind of crushing under its own weight. The bureaucracy of that just it's too much to handle. It's too complex, too many moving pieces. But even if they got that far, I don't think they could ban private medicine like Canada tried to do. Sweden is going more towards privatization. Canada had a lawsuit that allowed reverse that ruling, so now they allow privatization because to do otherwise would violate their own Charter of Human Rights. So unfortunately, it would create a have and have-nots, but I think the single-payer just again the pure momentum of trying to do that would stop it because the government doesn't have the power, as we've seen with the Affordable Care Act, to even force a bad product on people. People would rather take the penalty than buy an expensive product that doesn't serve them well, and they'll vote with their feet. So I don't think single payer could survive.
Well, part of my fear is I look at these group of people that are less than half my age. This is all what they're looking for. So can it only get worse? Are people just going to throw their hands up in the air and say, Obamacare doesn't work, we need the government to take all this over? I mean, that's just a thought of mine.
I think that's a possibility, but at the same time, Obamacare carries the government's name. It didn't fail because United made it fail. It failed because bureaucracy fails, because Silicon Valley is an area where there's little to no bureaucracy for innovative startup things, and ideas can flourish. So we need to kind of get to this idea that I find it beautifully ironic, even with the vice president's moonshot or I guess presidents as well, for curing cancer, is in part of that speech they talked about removing regulations that slow us down. It's like, ha! You admit that regulations slow us down, and so it's just as beautiful. Like even the government says, well, when we want a moonshot, then we realize that too much control of that. It's one Silicon Valley celebrates failures, fail early, fail often, and get back up and learn from those failures. The government's just going to have to embrace an innovative mentality more than just a regulatory mentality.
Oh, excellent. Well, we're out of time. This was incredibly enlightening. Thank you, Dr. Josh Umbehr, and thanks for the great work you're doing. I appreciate it.
It was a pleasure. Thanks for having me on.
You bet. Thank you.